Describing the cranial rhythm. The state of flexion and extension can be described using symmetry, quality, amplitude, and rate. These four characteristics, when moving optimally in flexion and extension, indicate a healthy system, which results from an absence of restrictions or compressions, in which case the cranial rhythm moves freely from its origin through all layers in the body. When movement is inhibited because of restriction or compression, the rhythm becomes altered or absent as it moves through the tissues. A cranial sacral therapist works to facilitate the release of these restrictions. The four characteristics can be described as follows. Symmetry compares the movement of right and left, or one area to another, to describe whether bones or areas reflect identical movement and flexion or extension. In other words, when feeling the cranial rhythm on the pelvis, do the right and left ASIS move the same way in flexion at the same time? Do they follow each other identically into extension? Quality. Quality describes how strong or discernible the cranial rhythm is versus a weak or gentle feeling. It also describes how smooth the movement is versus a shaky or intermittent movement. A strong, smooth movement indicates a healthy quality of movement, while a weak or shaky movement would indicate an imbalance in the cranial rhythm. Amplitude identifies how far flexion moves away from midline or how far extension moves back in toward midline. Amplitude is best described as the amount of time the therapist perceives the cranial rhythm spends in either flexion or extension. Example of equal amplitudes. The parietal bones spend 3 seconds going into flexion and 3 seconds going into extension. An imbalance is indicated when a cranial rhythm exhibits a decreased amount of time spent in either flexion or extension in relation to one another. Example of unequal amplitudes. The parietal bones spend 3 seconds in flexion and 1 second in extension. Rate. A cycle includes flexion and extension. Rate describes how many times the rhythm occurs in 1 minute. Combined sources indicate it is between 6 and 14 times per minute. Learning to palpate or feel the cranial rhythm is the foundation. We must first learn to sense this movement before we can find non-movement and apply the techniques for releasing compression. Remember, palpating this rhythm is the way to monitor the cranial sacral system and find restrictions. Often, the rhythm will be smaller or non-existent on an injured area. Compression from injury or trauma will also cause a lack of symmetry in the rhythm. The cranial rhythm is a very subtle and slight movement. A light touch is required to feel the flexion and extension of the bones. As beginners, we will be applying no more than 5 grams of pressure, the weight of a nickel. The goal of the cranial sacral therapist is to be as unobtrusive as possible. If your touch is too heavy, it can disrupt the rhythm. A touch with too much pressure will also undermine your efforts in contacting the movement. Sensing the cranial rhythm requires time and practice. The limbs of the body express flexion by rotating externally and extension by rotating internally. As the spinal nerves exit the dural tube, the fascia surrounding each nerve blends with the fascia it encounters upon exiting the vertebral column. The cranial rhythm is therefore transmitted through the fascia, much like ripples in a pond, and can be felt throughout. The limbs of the body express flexion by rotating externally and extension by rotation internally. Palpating the cranial rhythm. Do not be discouraged if you are not feeling or sensing the movement at first. Developing your palpatory skills is much like learning to ride a bike or learning how to swim. You did not have perfect balance the first time you rode a bike without training wheels, nor did you swim like an Olympian the first time you ever jumped into a swimming pool. No amount of book reading will teach it to you. It can only be learned through practice. So get on that bike and jump into that pool and get your hands on as many different people as possible. Center yourself and prepare for interaction, which conveys a quality of touch to the client. This is a time to remain focused with intention on the client. Enjoy the session you are helping to create. Do not hunt for the cranial rhythm. Turn off your analytical mind. You will have plenty of time to analyze what you feel in the time between class sessions. For these few minutes, let your intuitive senses rule and trust your hands. Technique. Place your hands on the area being observed. Use only 5 grams of pressure to listen. Hand placement. Feet. Stand at the client's feet. Cup the heels of the client's feet in the palms of your hand. The lateral malleolus of each ankle will gently rest against each wrist. An alternate hand placement is to rest your palms on the dorsal surface of each foot. Flexion will be felt as a lateral rotation. Extension will be felt as a medial rotation. Thighs. Position yourself on one side of the client, facing his/her head. Gently rest your hands on the client's thighs. Flexion will be felt as a lateral rotation. Extension will be felt as a medial rotation. Pelvis. Still facing the client, monitor the cranial rhythm at the pelvis by placing a hand over each ASIS. Flexion will be felt as a lateral rotation. Extension will be felt as a medial rotation. Shoulders. Sit at the client's head. Plane your hands over the tops of the shoulders. Allow your fingers to lie more on the lateral aspect of the shoulders to avoid interference from respiration. Flexion will be felt as a lateral rotation. Extension will be felt as a medial rotation. Head. Place a hand on each side of the client's head. Avoid covering the ears. Flexion will be felt in the parietal and temporal bones as a lateral movement. Extension will be felt in the parietal and temporal bones as a medial movement. Demonstration. Compression of ventricle 4. Origin of CV4. Compression of ventricle 4, CV4, is a technique that Dr. William Sutherland developed. This technique creates an overall state of relaxation for the connective tissue and the body. It produces a calming effect, releases minor restrictions, and accumulated stress in the cranial-sacral system. Contraindications for CV4. Do not perform this technique on infants, children under the age of 9, or clients who have been diagnosed with a cerebral aneurysm or who have suffered a recent stroke. Also see general contraindications. Contraindications to compressive techniques. Children under the age of 9. Clients at risk of stroke. Very elevated blood. Brain tumors. Performing CV4. Hand placement. Place one hand over the other at a slight diagonal position with the palms facing toward the ceiling. Bring your thumbs together so the tips make contact. Instruct the client to lift his/her head and place your hands so that the client's occiput is resting on the thenar portion of your hands, which should line up with the client's ears. Technique.